All right, continuing on with chapter 83 now. We're going to continue talking about the nursing care of patients with diabetes. So next up is foot care, which is super important for ATI. So I'm going to go over the bullets listed here on page 920 in my book, which is edition 9.0. So patients with diabetes should inspect their feet daily. Often people, so I'm a wound care nurse, right? And so half of my patients are diabetic patients probably. And so often these people end up with wounds on the bottom of their feet. They don't feel them. They have no idea they're there. And they get really bad before they figure it out. So if these patients were inspecting their feet daily, they would see the beginning of a wound before it gets to be something that goes all the way down to the bone. So inspect your feet daily. They should wash their feet with warm water and mild soap. They should always check the temperature of the water with their hands, because often their feet, they have neuropathy, so they're not able to really determine if the water is too hot, and they could end up scalding or burning themselves with water if they don't check it first with their hands. After washing your feet, you should definitely dry them thoroughly, especially between the toes. We don't want moisture between the toes because then they can end up with fungal infection. They should apply lotion on their lower extremities and their feet, but avoid putting the lotion between their toes because, again, we don't want a lot of moisture in there because that's where fungus loves to get if it's warm and moist. They should use mild foot powder, so like powder with cornstarch for sweaty feet. They should not use commercial remedies for removal of calluses or corns because they can end up with tissue injury or infection if they do that. They should definitely see a podiatrist regularly and get recommendations from the podiatrist. If they need to like trim their toenails, you want to trim them straight across, and you want to trim them after you've taken a shower or bath when the toenails are soft and easier to trim. If they have like overlapping toes, they can kind of separate it with cotton or lamb's wool. They should avoid going barefoot. They should wear shoes at all times. They should avoid open toe or open heel shoes. Leather shoes are preferable to plastic or synthetic type shoes. And they should wear slippers with soles and no going barefoot. They should wear clean absorbent socks that are made of cotton or wool, so no synthetic socks. They should not use hot water bottles or heating pads to warm their feet, again, because they have that decreased sensation. With neuropathy, they won't be able to tell if it's too hot. We talked about trimming the toenails. I think those are the main points for foot care, so definitely know those. Other kind of nursing teaching we should do for these patients is we should encourage them never to skip meals. They should know like 15 grams of carbohydrates are equal to one carbohydrate exchange if they're following like the ADA guidelines for managing their diet. They should restrict their calories and increase their activity to help lose weight, which will definitely help with their glycemic control. They should call the provider if their blood glucose is greater than 240 or if they have a fever or infection going on. So if they have a fever greater than 38.6, which is 101.5, they should call the provider. If they start having that Kussmaul respirations, like rapid breathing, they definitely want to notify their provider. Patients who are diabetic and get sick are at risk for very serious complications of DKA or HHS, which are two conditions we'll talk about in the next chapter. So, other complications associated with diabetes. At the beginning of my last video, I shared that diabetics are at higher risk for a number of conditions. So we're going to go a little more into detail in that now. So diabetes can cause cardiovascular and cerebrovascular disease. So it's really important that you monitor that patient's blood pressure, check their cholesterol regularly, and encourage a diet of low-fat meals that are high in fruits, vegetables, and whole grain foods. Patients with diabetes are also at risk for diabetic retinopathy, which can lead to impaired vision and blindness. So it's really important that they get at least yearly eye exams and then really manage their blood glucose levels very strictly to prevent further deterioration of their sight. Diabetic neuropathy is super common with diabetics. So this is damage to the sensory nerve fibers. which can cause numbness and pain. It can also lead to ischemia and infection. And I see these wounds all the time that are infected and ischemic. So good and bad. I mean, the bad news is they don't have good feeling in their legs. The good news is when I'm working on their wounds and like cutting stuff away, they can't feel anything. It's pretty crazy. And then lastly, I'll touch on diabetic nephropathy. So this is damage to the kidneys as it relates to diabetes. So it's going to be really important for these, for patients that you monitor their eyes and nose, take a look at their BUN and creatinine, make sure that they have urine output of at least 30 milliliters an hour. And if they don't, you want to report that to the provider. You want to encourage them to avoid alcohol, acetaminophen, and NSAIDs, which can cause further damage to the kidneys. And they need to consume at least 2 to 3 liters of sugar-free fluid per day, ideally water, to help prevent dehydration and damage to the kidneys. So we are finally through chapter 83 here. So we have one more chapter on complications of diabetes, and then I think we're done with the endocrine. Yep, we're done with the endocrine system after the next video. So thanks so much for watching, and I'll see you on the next video. Thanks.